Hello, my name is Marissa Rivera. I am a registered nurse at a level 2 trauma center in Clear Lake. I'm currently working in the ICU on night shifts. And for today's discussion post, I wanted to be discussing how AI can be used in our workplace and how it can better assist in our challenges in timely documentation. So our current challenge right now in the ICU, and it's always been a challenge, is documentation. We may have two patients, however, the majority of the time they're very critically ill, and we need to document things like our eyes and nose for EVDs or chest tubes or skincare. We have to do a full assessment. We have to document in our nursing notes on doctor and family interactions. Sometimes these documentations can be hourly, or if you have a stroke patient, it's every 15 minutes. So I believe that AI can be extremely helpful in our workplace. We are moving from Meditech to Expanse, so I know that there may be some implementation on that. But AI can help monitor our patients' vital signs, lab values, diagnostics, and kind of give us a early alert on how our patients doing if they're in respiratory distress or are showing signs of pneumonia, or even early alerts on sepsis. So that use of AI can definitely improve patient safety. It gives us early alerts for timely interventions, reduces our stressors, our burdens, and most importantly, we're able to be with our patients. On the downside, there is a downside to utilizing AI in the workplace, and those could be things like staff training. A lot of hospitals may not want to have the funding to that. It can also be time consuming getting everybody in the hospital to get on board and be efficient in AI and how to use that properly. And it can also be a patient safety concern, because there may be talks about patient safety being exposed to these AI companies and not knowing where that information may lead to. But the biggest thing to take note of is that AI should not replace nursing judgment. A lot of our bedside nurses are very efficient and can recognize early signs and may have early interventions based on their clinical judgment. And also another thing is a lot of nurses may get used to the idea of AI doing the work for them. But overall, I do think that if AI is utilized in a proper way and there is thorough training on how to use it, it can definitely be useful in timely documentation, and we're able to provide patient care the best way that we can. And we're able to be with our patients a lot longer than just sitting at a desk documenting.